Good morning, folks. Thank you so much for joining our budget kickoff here from Advocates for Ohio's Future. Happy Friday. It has certainly been a big week in the state government world here in Ohio. We had the State of the State address given by Governor DeWine to hear his top priorities from his budget and for the next General Assembly. And then the state budget, the blue book, so kind of the governor's executive proposal, was dropped later that night in the dark of the night, just a few minutes before midnight. So we have spent the last few days combing through his initial proposal. Again, we are waiting on the details of the budget, kind of that budget language, a little bit deeper in the weeds. We expect that to be released later in February, probably the next week or so. But we are really excited to have a really great group of Advocates for Ohio's Future's members here with us today, of experts to share kind of their initial analysis and following the title, what was good that we saw in the governor's proposal, what's missing, and what's next. So really to talk about that what's next piece, I'd like to introduce Sarah Hudasek. She's Advocates for Ohio's Future's Policy and Communications Associate. She is really the brains and the push behind your newsletter, helping with these webinars, an incredible policy analyst and really advocate here. So we're excited for you, Sarah, to hear what you have to share with us about what's coming up next. Sarah, please take it away.
Great. Thanks so much, Kelsey. So I want to get started this morning with just a brief overview of the timeline for the budget process that we've just entered. This week is the official start of the budgeting process. And this graphic that I pulled from the Blue Book shows that the governor's executive budget that was released earlier this week is really the culmination of months of work by the governor's administration to formulate the Blue Book, but this graphic does make it look like we're halfway through the process, but this week is really the beginning of the process where advocates can play a large role. So what does that look like? The process is going to start in the House of Representatives, where we're expecting budget hearings to kick off next week in the Finance Committee and the 7 subcommittees. And the budget will go through hearings in those subcommittees, and then each subcommittee will submit a report with proposed changes to the full Finance Committee. And then the full committee will then adopt what's known as a substitute bill, which is an amended version of the budget bill. And at each step of the process, the legislature can change, edit, add, remove any provision to the original budget. So what we saw this week is really the groundwork for what's going to happen, but doesn't predict what the House of Representatives might add, what the Senate might add, all throughout the process. So then additional hearings will be held on that substitute bill. Then an omnibus amendment, or one bulk amendment that includes dozens of changes, will be added to the substitute bill. The bill will move out of Finance Committee to the House floor. It'll be voted on the House floor, and then it'll move to the Senate, and the whole process starts over again in the Senate from April to June. Once the House and the Senate have both passed their versions of the bill, each chamber will generally not concur with the other's changes, and that will trigger for the bill to move into conference committee, where a small group of legislators, largely in private, will iron out the differences between the 2 versions of the bill. So because that conference committee process is so private, it can be hard for advocates to really influence this stage. And so that's why it's really important for advocacy on your issues to be taking place throughout the entire process, and why we're so far out from the final version of the budget and we're already talking about, what's coming down the pike and what this first step means for us as advocates. So the conference committee version will then be passed by both chambers and sent to Governor DeWine, who must sign the budget by July 1st, 2023. That's when Ohio's new fiscal year begins. And at this step, the governor can line item veto provisions in the past budget, but he can't add or edit any provisions. So if anything from his executive budget is taken out by the House and Senate, he can't add it back in at this point. He can only approve or deny what's already there. And this applies to both appropriations provisions and policy provisions that are included in the bill. And so this means that the legislature passed version isn't the end of advocacy. There's a small window for advocacy asking the governor to line item veto certain provisions. So with that really broad overview of this whirlwind process that we are approaching, I'm really excited to turn it over to Kelsey Bergfeld, the director of AOF, to share what AOF is going to be working on over these next 5 months.
Wonderful. Thank you so much, Sarah. And yes, so this is your Advocates for Ohio's Futures team here. So we are really happy and proud to represent the coalition. We are lucky to work with this incredible group of advocates each and every day, as well as do our coordinating and making sure that we are all aligned on priorities, really what's happening at the State House, what's happening at each stage of this process. We know things get busy very, very quickly, get hectic very quickly. So it's great to be able to rely on this incredible network of health and human service advocates, really experts in this field. I know that there are advocates at our table who have been, this is my 5th budget, but this may be their 10th budget, their 20th budget. Oh my gosh, I can't even imagine. And they've seen all the things that there are to see, and certainly provide a lot of incredible knowledge on this process and best practice and strategies to be successful. So next slide. Sarah, thank you so much. And just to share just a bit about our coalition, again, let us take a step back. We are a nonprofit, nonpartisan coalition of over 500 state and local health and human service advocacy, policy, and provider organizations, really united to make sure that all Ohioans live better lives. And really, our coalition believes in investing in our state's most valuable resource, really our people, right, to make sure that we're safe, healthy, and live in really quality communities with opportunities to succeed. So when we think about Health and Human Service Coalition, it is really wide-ranging. If you name an issue, most likely we have that issue represented on our coalition, that viewpoint, as we come together with priorities and we think about really which issues really impact our coalition as a whole and our issue areas as a whole, understanding that we can't really work in silos to really improve and make a change for families across the state. We have to work in alignment and conjunction with each other and support each other for the betterment of families all over. So very, very briefly wanted to share really what we will be focusing on as a coalition. Of course, we support and do what we can to echo and enhance the priorities of our member organizations, but some things that we will be pushing and protecting throughout this process, these next 5 months and the remainder of the General Assembly, making sure that coverage protections and supportive services are strengthened as enhanced COVID era benefits and program flexibilities expire. We know that there have been some enhanced benefits in the SNAP or food stamp program that are expiring here this month. Families will see a drop in those benefits come March. We are doing what we can to make sure families are aware and share different resources to make sure that they get their highest benefit level possible. And we also know that Medicaid continuous enrollment or continuous eligibility provision will expire come April 1st of this year. So we know that the entire Medicaid caseload will be redetermined, or those renewals will happen, those eligibility statuses will be updated over the next year. So we are keeping an eye on that process, as well as making sure that we are communicating with our community partners, with Medicaid recipients, with health programs and health systems to let them know of these changes and what folks can do to make sure they maintain their eligibility and what other options they have if folks find that they are no longer eligible for the program. So lots of changes in some of those basic needs programs coming in the next few months, making sure that we're keeping an eye on them and determining if and when any kind of state intervention or kind of a reset is needed as these programs begin to expire. Of course, maintaining and expanding Medicaid eligibility so all Ohioans get the health coverage they need. Specifically, 2 of the issues that we're pushing for this GA, expanding general Medicaid eligibility up to 300% of the federal poverty level for families and children. We saw some success. The governor seems to think that's a good idea as well, at least for pregnant women and babies. We're really excited to see that expansion included in the governor's proposal. You'll hear much more about that later, as well as if we could allow continuous coverage for children up to age 6, that would be incredibly helpful for that healthy start and best beginning for kids across the state. And of course, really one issue that we are set up to tackle cohesively and in a big way is making sure that we think through and begin to formulate some solutions to the benefit cliff that really exists across all public programs here in the state, making sure that families, as they continue to either earn more or are no longer eligible for programs, that all tends to happen at once. And that's a really big barrier for families when it comes to earning a couple additional cents or getting a raise or a promotion in their job. They could deny that promotion, they could deny extra shifts and such because the benefit that they do receive and help and support that they do receive through these programs, if lost all at once, is certainly a huge impact to their bottom line and to their family's budget. So we will be convening a group kind of after the budget to think about a cohesive and really comprehensive way to address the benefit cliff issue, looking for additional partners on that as well. And then coming up next, Sarah, on that, I wanted to share first, you heard it here first. I don't think that these committees have been announced yet, but wanted to share the House Finance hearing schedule. So in terms of process, the House, of course, starts those hearings, specifically the full House Finance Committee will be meeting next week, Tuesday, Wednesday, and Thursday in the mornings. And then we also cannot forget that the transportation budget is also kicking off during this process. So we will have 3 hearings next week. We'll hear from OBM and LSC on Tuesday. We will hear from Medicaid agency on Wednesday on the operating budget, and that's just Medicaid for those 4 hours. So make sure you're comfortable, you bring water, you hydrate if you're coming to any of those hearings or you're watching at home. And then Thursday, the Ohio Department of Education and the Board of Regents or Department of Higher Education will be heard in full finance. So you heard it here first. Again, those hearings can be watched online at the ohiochannel.org or on the House Finance Committee website. And without further ado, to share what was included in the governor's proposal, kind of a first look, what we liked, what we don't like, what's missing, and really maybe some opportunities for continued advocacy here. We are excited to introduce and welcome Soley Hernandez from the Ohio Council of Behavioral Health and Family Service Providers. Soley, take it away whenever you're ready.
Thanks, Kelsey. So as Kelsey stated, I'm Soley Hernandez. I'm with the Ohio Council. So I'm going to go over just the initial kind of insights on behavioral health in the budget proposals. So if we can go to the next slide, just a little bit about the Ohio Council if you're not familiar with us. So we are a trade association and we represent a little more than 165 behavioral health provider organizations across the state. And so we do a number of things, but policy and advocacy at both the state and federal levels is a main piece of what we do, along with member technical assistance. And if you know anyone who may be wanting to join, please send them to me. But we can move on to the next slide. So just a little bit about our budget priorities for this biennium. Our budget priorities as the Ohio Council and for the members that we represent really look towards improving quality and expanding access to treatment across the state, enforcing mental health and substance use disorder insurance parity for Ohioans, strengthening the behavioral health workforce pipeline, supporting statewide prevention efforts, investing in the behavioral health crisis services continuum in the state, as well as integrated care delivery models, and then improving outcomes through recovery supports and population health strategies. So we can move to the next slide to get into kind of our initial thoughts about the budget based on what we know currently. We are feeling optimistic so far. Certainly appreciate the governor's continued support for children, youth, and families and their whole health, which does include mental health. And specifically really that focus on building out the community behavioral health care system. If you've been, listening to his speeches the last few months, he really has focused on this idea that we've never built out the system of behavioral health care in the United States, honestly, but in Ohio specifically since deinstitutionalization. So we are really feeling optimistic about what that could mean for the budget. and our members that are providers of these valued services. The other piece that we're keeping an eye on, but we're very excited about, is the creation of the State of Ohio Action for Resiliency Network. And so this is being developed to really understand those root causes of both mental health and substance use conditions across the state. So, this is basically kind of a research hub, but a research into practice hub, which will certainly be interesting and I think will be beneficial both for people who need treatment and the organizations that provide treatment. So we can move to the next slide. I'm going to talk a little like department by department that impact behavioral health providers and what we're kind of looking at and highlighting that we know so far. So Medicaid is a significant payer of behavioral health services across the state. The recommended budget does invest in historic provider rate increases. So we are feeling good about that. We haven't seen rate increases for behavioral health for quite a few years. And so really looking forward to kind of those details. But those rate increases for Medicaid will certainly help providers with being able to pay their staff more, which should help with the workforce shortage, because that will help support higher wages. And then just really being able to have or provide better access to people who need services. So the next slide will go over the Department of Mental Health and Addiction Services budget items that we know currently. So the department is investing $20 million for local county ADAM boards to look at investing in their local priorities for prevention, early intervention, and suicide prevention. There's also $20.5 million to improve community treatment and recovery supports for Ohioans living with severe mental illness. So this is a budget item that is essentially being almost doubled. It was in the last biennium at about, I think it's 11 million. So it really will be helpful to continue what is being called the multi-system adult project. So if you're in this field and have heard that terminology, that's what that kind of references. The next is the 16 million for forensic centers. So this is a much needed area. The state regional psychiatric hospitals are almost all of them, the majority of the beds available there are for forensic patients. So having more funding for outpatient forensic centers should help alleviate some of that congestion in the regional psychiatric hospitals. And then there's 663 million, and part of this is budget funding, and part of this is federal ARPA funding for investing in the behavioral health workforce and looking at just ensuring people know that this is a career field that's available, and then growing workforce opportunities for, to retain current staff and then recruit in new staff. The next slide is the Department of Insurance. So I did mention parity is one of our budget priorities, and they certainly have been doing work around this for the last few years. So the Department of Insurance did launch a campaign to help Ohioans better understand their mental health and substance use insurance benefits. And they've been continuing on that work, and they're calling it their mental health. Ooh, I forgot what the acronym is MIA. It's MHIA. So it's their Mental Health Insurance Assistance Office. And so that is something that is currently up and operational and available, and more information is on their website. And so they are continuing to build on those efforts as well. In the next slide, we'll see the new Department of Youth and Children and Youth. So there is funding for increased investment in early childhood programming, 119.4 million for Help Me Grow programs, 11.3 for early childhood mental health credentialing. And then there are funding supports for new and existing initiatives to prevent children from entering foster care and expediting that permanent placement. And so often, behavioral health treatment kind of wraps into all of these areas. And then the next slide. Okay, so this is kind of what we're looking out for, what we don't have quite the details we want yet. So we're waiting on specific policy and investment details related to the behavioral health crisis infrastructure and service development, which includes 988. So I think everyone is aware that 988 went into effect last July, but there is a lot of behind the scenes work that is still going on to really make that successful and fully connect that to both 911 and then service providers of mobile response services. So that is an area that we're watching out for. Additional information around recovery housing and other recovery supports. And so really this is more specific to the recovery housing is specific to substance use disorders, and that's a specific setting of housing that can be certified in Ohio. And then insurance parity enforcement efforts. So we know ODI has the MIA office and they've really been focusing on this, but we're kind of keeping an eye on where there is either policy or investment to really look at ODI enforcing parity violations by insurance companies. And then the school-based behavioral health funding, what the levels and specific requirements. So the, student wellness and success funds have been around in a couple iterations, but have had varied funding amounts and varied guardrails on them, and have been able to really be used for a number of things that don't end up being used directly for treatment in schools. So we are kind of keeping an eye on those things. And I think that's my last slide. I have one more that just has my email. So if I have a few minutes left still, I am happy to take any questions, but also you can email me.
Soley, thank you so much. So we are going to go ahead and move on to Tim, if that's okay. But we are going to, again, we just want to remind folks, we did put it in the chat, but please feel free to submit questions via the chat or via the Q&A function here. I know Sarah and I will be monitoring that the entire time. And then if we do have some time between speakers, we do have a set schedule. We have lots of folks to get through. We will take them live as we continue, or of course, lots of time at the end as well. So we are happy and excited to welcome Tim Johnson from the Ohio Poverty Law Center to join us next. Tim, take it away.
All right, thank you so much, Kelsey, and good morning, everyone. Tim Johnson, Senior Policy Advocate with the Ohio Poverty Law Center, but also a member of the Ohio-led Free Kids Coalition leadership team, and that is sort of the hat I'll be wearing today as we talk about lead poisoning prevention efforts and the governor's budget. So before we get that far, let's talk about the problem. First, I want to remind folks that there is no safe level of lead in a person's bloodstream. It's all incredibly harmful. Lead dust and lead paint from old housing is the #1 source here in Ohio of lead poisoning. Over 90% of lead poisoning cases are from lead dust or lead paint chips in older homes. 2/3 of our housing stock was built before 1980. And there's an estimated 427,000 plus children under the age of 6 who live in these older homes. So Ohio has a lot of aging housing stock that includes a lot of lead hazards. And every county has young children in these houses with these lead hazards. So always want to make sure that I point out that this is not an urban problem. It's not a rural problem. It's not a suburban problem. It's all of those problems. It's in every corner of the state. In all 88 counties. So there's no place in Ohio that's really untouched by the lead issue. The percentage of Ohio children testing positive for lead blood levels is higher than the national average. It's actually double. And just want to mention that Ohio children test for elevated blood lead levels #2 in the nation, which is not great. Lead has lifelong impacts, including a whole bunch of different issues like hearing loss, speak language development issues, nervous system damage, cognitive problems, mental issues like decreased IQ, possible attention deficit disorder issues, all sorts of different things. Not only that, but it has impacts further down a child's life. They're at a high risk of being not ready for kindergarten, more likely to experience not only the juvenile justice system, but also be incarcerated as adults. More likely to need specific services as they get older. I have said this before in the last budget, and I'll probably say this again many more times this budget, but there is no cost savings to ignoring the lead issue. There is the human cost that affects the person, but there is also a cost to us as a society as we pay for the specific lack of upfront prevention services for folks who have been affected by lead. You can go to the next slide. So what is in the budget, at least upon this sort of first initial look that we can tell in terms of lead poisoning prevention? Well, there's additional funding, which we are always happy to see. Governor DeWine has made it a priority of his administration since he was elected to tackle the lead issue in a way that no other governor has really done before. We're seeing $22.4 million over the biennium for various lead prevention programmings within the Ohio Department of Health. That is a significant increase over the most recent budget, which I think tops out at just a little bit over 11 million. So we're essentially seeing close to double the amount of investment in lead poisoning prevention programs, which is excellent. That includes funding to continue the Lead Safe Home Fund, which was created last budget, which was sort of a first of its kind fund to allow for local governments and communities to get funding from the state to either start their own lead poisoning prevention efforts or to expand ones that they're already doing. So we're very excited to see an increase in that funding. Continuation of lead safe funding for the city of Cleveland. They have been getting about 1 million each fiscal year for the past couple GAs, and they have managed to leverage that with their private partner or private public partnerships to pull down a lot of additional dollars. And they've also recently invested some local ARPA dollars into their lead poisoning prevention efforts as well. So they're doing great work up in the city of Cleveland, and we're glad the state is continuing to choose to support that. We also have seen increased H2 Ohio funding. So that is getting a significant bump to 31.3 million each fiscal year. Not all of that money is specific to lead service lines. They can use it for a lot of water quality issues, sewer treatments, and a bunch of different other things. But some of that will be used for lead service lines. Ohio actually has the second highest number of lead service lines in the country. So again, we're number 2 in an area that's not great. But glad to see that the governor is choosing to increase his investment into the H2 Ohio funding to tackle the issue. You can go to the next slide. What are we watching? We're watching the fact that the Part C early intervention funding was flat funded for fiscal year 24 and 25. Some people may not know this, but children under the age of 3 who test for elevated blood lead levels are actually eligible for early intervention services to help mitigate some of the damage that has done. Currently, the state of Ohio right now is actually considering a rule change that would lower what the elevated blood lead level threshold is from 5 micrograms per deciliter to 3.5. Once that is completed, we expect there to be a rule to allow children who are under 3 to qualify for those services if they test at that new 3.5 level. And as you would expect, that will lead to more children testing positive for elevated blood lead levels. We want to make sure that the funding is there to compensate for those additional kids who we believe will be testing positive for that. And we do plan to work with our legislative partners on increasing that early intervention funding. Next slide. And then my last slide, what's missing? Well, the Blue Book doesn't talk about Ohio taking over enforcement of the renovation, repair, and painting rule, what we call RRP. For those who don't know, RRP was created in 2010 at the federal level and essentially requires contractors that are doing work in older homes to do so in a lead-safe manner. So they're not stirring up paint chips and paint dust. They're tarping off appropriate areas. They're sealing vents and windows and things of that nature. But the enforcement of that, which happens at the federal level, is haphazard, hit or miss. Sometimes complaints are ignored. When they are handled, oftentimes the fine can be incredibly hefty and burdensome. States are allowed to take over enforcement of this rule and do it in a way that's more user-friendly, that's more based on making sure folks are compliant rather than it being purely punitive. 14 states to date have done this, and it's a decent mix of red and blue states. And so we're hoping that Ohio will want to take this on. It was a priority in the governor's last budget, but there just isn't any mention of it in the Blue Book currently. So we are going to have to wait and see if that is actually something that made it into the budget bill language when that bill is ultimately released within the next couple of weeks. So a lot of good things in here, a lot of things we're keeping our eye on, and happy to answer any questions in the chat as we move forward.
Tim, thank you so much. As of this moment, no questions directly for your subject. I know there's plenty coming in, but I actually want to invite Soley back for just a moment. We have a moment here before we move on to our next speaker. Soley, we have a question. Does the OMAS budget include any provision or allocate new funding to address children's behavioral health specifically? It seems like the new department of children and youth is more focused on early childhood. Do you see any programs moving to the agency that would address school age behavioral health programs?
So I am not aware of anything specific currently, but besides that prevention funding I mentioned for the ADAM boards, so those prevention funds are usually utilized in schools for prevention services, but sometimes for treatment as well. But the one change, at least from a policy level, regarding Medicaid and the school Medicaid program being open to anyone with Medicaid will certainly allow more treatment to happen in schools. But that's all I'm aware of currently.
Excellent. Thank you so much for that, Soley. And I see you're typing an answer in the chat as well, or in the Q&A to another question. We appreciate you. We will move very quickly to our next speaker. We're excited to welcome Lisa Hamler-Fugitt from the Association of Foodbanks. Lisa, thank you so much for being here. What's going on with food support and nutrition in the governor's proposed budget?
Thank you, Kelsey. I want to thank Advocates for Ohio's Future and Kelsey and Sarah for putting this webinar together today, as well as all the fellow presenters on this. I represent the Ohio Association of Foodbanks. We believe that this budget has the opportunity to continue to build on decades-long partnerships that we've had with the state. Our 12 food banks provide food funding, training, and technical assistance to a network of 3,600 member charities. 70% of these member charities are faith-based organizations operated by largely volunteers, senior volunteers, and on budgets of less than $25,000 a year. So they rely very heavily on our network for the supply of food. And in 2022, while the demand was elevated at levels that were higher than at the height of the pandemic, we experienced 50 million fewer pounds to distribute due to supply chain disruptions, as well as pretty significant declines in our federal commodities, as well as a decline in private industry donations at a time we were seeing record high prices for food. 20% of all the food we distribute statewide comes from the state of Ohio. Next slide, please. The success of our programs are really important to helping to address many of the issues that we are facing with families who are really struggling to recover from the pandemic. And while the number, 85% of the jobs that have been recovered have returned, unfortunately, high inflation is really eroding what income individuals have. And you can see here, higher food costs, certainly higher energy costs and housing costs. Next slide, please. In the first half of the year, food banks provided groceries over 6 million different times to Ohioans. And as I said, we surpassed the height of the pandemic in the demand on our system. And that even includes the 1.5 million Ohioans who were also receiving and have been receiving the enhanced SNAP benefits as a result of the public health emergency. Kelsey mentioned this at the beginning, and I want to reiterate it, that this February is the last month for those enhanced SNAP benefits that have provided over on $90 per person per month. Will be lost on that March issuance. So we are bracing now. This is going to disproportionately hit low-income working families, and older adults and persons with disabilities are going to be hit the hardest. And it is estimated that Ohio will lose about $120 million a month in upwards of between 1.2 and 1.5 billion of benefits. These are 100% federally funded benefits as a result of this rollback. So Ohioan food banks are going to be called on more to help fill the gap, and we're going to need more support than we've ever gotten before. Next slide, please. Again, we have had decades-long experience in partnerships. We know that we support Ohio's workforce when families who are struggling economically can't meet their basic needs. They turn to a food bank. They also will turn to a food bank at a time of a crisis. We're feeding more families with children. We know that hunger pays a horrible impact on kids' ability to learn. It also rates of hunger increase chronic diseases, which is a major driver of our healthcare cost, everything from heart disease to diabetes. In fact, 58% of the households that we currently feed in our network have at least one member with high blood pressure, and 1 in 3 have a member that is experiencing diabetes, a diet-related disease. Our programs also support the agriculture industry, and we believe that climate smart agriculture and the challenges that we face are going to impact all of us. So again, these are investments in the future. Next slide, please. Just to reflect a little bit, I want to say that we are extremely grateful to the governor and to members of the General Assembly who've made critical investments in hunger relief throughout the course of 2021 and 2022 in the pandemic. We have received $12 million in coronavirus, $15 million in ARPA that allowed us to work with Ohio agriculture and livestock producers to secure protein. We just recently received another $25 million in ARPA, again for shelf-stable purchases. And in the last budget appropriation, we were at $24.5 million per year. And that helped us secure more than 100 million pounds of food. Next slide, please. The budget, unfortunately, does level fund food banks at $24.5 million a year at a time when we're looking at pretty significant looming crisis of the loss of SNAP benefits. The budget request that we are making now is for $50 million per year. So we will be working with you as advocates in our network, as well as members of the General Assembly, to help identify additional resources that can help bring this line item up. 49 million of that would be spent on the purchase of food, as well as non-food items such as personal care, personal hygiene, and household cleaning products. And another $1 million would be used for capacity building grants. Next slide, please. Also, other opportunities that we really want to point out that we think the state needs to step up. The loss of the SNAP benefits, as I said, are going to disproportionately impact seniors and persons with disability who are going to see their benefits fall back to the minimum level of issuance. And we believe that the state should provide a minimum SNAP funded benefit of $50 per month, an opportunity to expand universal free school meals to all children. We believe an education is important. We need to make sure our kids are fueled and ready to learn. Expanding the summer program and outside school hour time programs are really important to make sure that kids are getting the adequate nutrition that they need when they are not in school. We also need to work to protect SNAP as well as Medicaid, and support additional and provide more adequate funding for our state agencies, as well as our county operations that are going to be called on to do more overall in the area of health and human services. And again, we have to address this benefit cliff for families who are working. This is critical for family stability, and we are calling on the General Assembly to make the state earned income tax credit refundable, putting money in people's pockets. Next slide, please. Hunger has never been a partisan issue in the state. We have had a long history going back to then Governor Voinovich. This will be our 14th general appropriations budget for over 28 years. Again, hunger affects all of us. It is a major cost driver for our healthcare system. It's lost educational attainment for our children and lost productivity for our workers. So again, thank you very much. If anybody's got any questions, I would be pleased to take those now. And thank you again. It really is a no-brainer. Thank you.
Lisa, we are very happy to support you, and we agree completely. Up next on our agenda, we are really excited to welcome Darold Johnson from the Ohio Federation of Teachers. He also proudly serves as the co-chair, one of our co-chairs here at AOF. And we are very thankful for his leadership. So Darold, whenever you're ready, take it away.
Thank you, Kelsey, for that introduction. And it's good to be with everybody this morning. We're happy to talk about education. And so basically what we see in terms of the big piece coming out, the positive coming out, the state of the state and the governor's budget is his commitment to the Cup-Patterson funding plan. The Fair School Funding Formula would give us a constitutional formula that will allow 60% of the money to go directly to classroom instruction, provide money for wraparound services, and have money for administrative and training of teachers. And so we would like to see that fully implemented in this budget so that we can make sure that every child everywhere has a good quality education. We're also pleased that he focused on the literacy program and literacy effort, and making sure that we have reading specialists and making sure that every young child gets the opportunity to be able to read by the 3rd grade. The Department of Children and Youth is also interesting to us. We would like to see how that works because we're also working with Franklin County Children's Services. Their staff is our members, so we want to make sure we have good children's services for Franklin County and every county in Ohio. The $300 million for the career tech updating is very significant and needed. We need to upgrade some of the career centers and get them the latest technology so they can prepare that workforce. In terms of higher ed, because we also represent higher ed, we are happy to see the OCOG increase and allowing it to go to community colleges and regional campuses. We would like eventually to see, well, hopefully the budget process, see that move from a last dollar grant to a first dollar grant so that we can make sure we truly benefit those who are in need. And then the $5,000 scholarship for students in the top 5 of the class, keeping them in Ohio. That was something that we were very much interested in as well. We had some concerns about this whole expansion of vouchers to families up to 400% of poverty. That's kind of concerning because we're draining off dollars that could go to public education. There's 1.7 million children who are in public education, and 9 out of 10 children, school-age children in the state, receive their education from public schools. And so that's where we think we should have the emphasis. That's where our state constitution says the emphasis should be for a system of common schools. So we're looking to make sure that continues. Some of the things that we are concerned about there is the effort to help children overcome their academic loss due to the pandemic. We didn't hear much about that. There were some things in the budget that the Department of Education did move forward on that. Again, he did move the wellness services into the foundation formula so that they could be spread throughout the state. That's a good thing. And then we would like to see state share instruction, get more information on that, because one of the things is Ohio is one of the highest states to get a college education. And people keep talking, legislators keep talking about us not meeting the goal of having 65% of our residents with a bachelor's degree. Well, it's tough to do when you incur debt and you don't get debt relief when you get into different professions. So we would like to see them do more around the issue of tuition reduction or freezing, those kind of things. So those are the short pieces that we've heard for our concerns about the education budget, and look forward to any other questions.
Excellent. Darold, thank you so much. We do have one quick question. Do you know if the 3rd grade reading guarantee will still be the way that the 3rd grade standard is currently measured? Or are they making any changes to those requirements?
So we did have legislation in the last General Assembly that would remove the retention requirement for the 3rd grade reading guarantee. That was supported by the State Board of Education. But so far, we haven't seen any language to remove the retention part of that. So we will continue to work on that issue, though.
Understood. Darold, thank you so much for your time. And up next on our agenda, we're happy to welcome Kelly Vyzral from the Children's Defense Fund, Ohio. Kelly, tell us what's in there for kids.
Thanks, Kelsey. I appreciate the opportunity to address this webinar and talk about children and family proposals in the governor's budget. As Kelsey said, my name is Kelly Vyzral. I am the Senior Health Policy Associate with Children's Defense Fund, Ohio. If you aren't familiar with CDF Ohio, we are an independent voice for children. Celebrating our 50th anniversary, we are rooted in the civil rights movement and are committed to defending the joy of childhood, making sure that every child in Ohio has a safe place to live, access to quality health care, proper nutrition, and quality education. Next slide, please. One of the big things in the governor's budget is the creation of this new Department of Children and Youth. You heard a little bit about it in a couple different presentations. It touches a lot of different areas. Their goal is to promote efficiencies. They're going to combine these functions and programs to have a better service delivery. We don't really know much about it. We haven't seen a lot of language, just these basic things, trying to reduce duplicative programs across the state. The programs are going to include prevention and early identification, like home visiting, the Children's Trust Fund, infant vitality funds, early education programs like publicly funded childcare, early childhood education, preschool special education, and licensing issues. And then they'll also deal with support issues with children's services, Ohio Family and Children First Councils, Healthy Beginnings at Home, early childhood mental health consultation, and strong families, safe communities. It's going to start on July 1st. It will take 18 months to stand this up, so it'll actually go live or be fully operational on January 1st, 2025. Next slide, please. As far as early identification and prevention items in the budget, the home visiting program is going to get an extra $36.7 million over the biennium for the Help Me Grow program. The goal is to reach 17,000 families, or almost 18,000 families. The current reach of that program is 9,000, almost 10,000 families. So they're almost trying to double the reach of the program, including enrolling 86% of eligible pregnant women. The infant vitality funds are going to be $11.2 million increase in the budget over the biennium. And Ohio Family and Children First Councils will get $1.3 million, which doubles their the investment in that program as well. Next slide, please. When we look at early education, we have the expansion and eligibility of the publicly funded childcare from 142 up to 160%, which is great. Not perfect, but much better than 142. That means that a family of four making $47,000 would be able to take advantage of this program. And if you look at the cost of childcare, $47,000 for a family of four it's not a lot of money when you're looking at paying for childcare for one or more children. But it will allow more than 15,000 children to gain access to that publicly funded childcare. There's $150 million in ARPA funds to provide scholarships and increase the infant toddler capacity, and also $46 million in increased investment in the Ohio Department of Education early childhood education, which is estimated to serve an additional 11,000 children under the 200% of the federal poverty level. Next slide, please. The Medicaid provisions in the budget, we're looking at expanding coverage for pregnant women and children to 300%. Super excited about this. It really does protect working families who don't qualify for Medicaid, but who can't afford private coverage or coverage on the marketplace. It's going to create health coverage for privately adopted youth with special health care needs. This is currently only available for public adoptions. Thereby, hopefully encouraging people to to adopt children, modernizing the Medicaid in Schools program to cover all Medicaid eligible children. This is huge. We've been working on this in Ohio for several years. Many people on this call have been working on this program, trying to get Ohio to open up that program. This blends state and federal dollars to pay for physical and mental health services in schools for Medicaid eligible students, but currently is limited to those with individualized education plans. CMS will cover 2/3 of the existing costs, allowing for a real significant expansion of services. 17 states have already done this, and we're really excited that Ohio is, looking to take steps to open this program up as well. Next slide, please. As far as additional supports, Soley mentioned some of these mental health. I've got a cat here who wants to partake in the webinar. $20 million over the biennium to expand early childhood mental health consultation. $11 million for early childhood mental health credentialing to expand the workforce. As far as taxes go, there's a $2,500 child tax deduction. Sounds great, and that's wonderful. An actual tax credit would be a better way to go about this and would allow more people to keep money in their pockets. And then also elimination of the sales tax on critical infant supplies such as diapers, wipes, cribs, car seats, strollers, and safety equipment. As far as nutrition, they're expanding the nutrition assistance coordination across SNAP and WIC, allowing if someone qualifies for WIC, they qualify for SNAP. If they qualify for SNAP, they qualify for WIC, and helping the coordination between those two programs. So that's, that's great news as well. Next slide, please. Now, these are my wish list items. I don't want to be greedy, but this is my wish list. Along with the 300% of Medicaid expansion, we'd love to see Medicaid continuous eligibility for children through age 6. This allows children to make sure that they're getting all of those early well visits and tests and immunizations and things that they need to make sure that when they turn 6, they're ready to start school and learn. According to the American Community Survey, this would affect around 25,000 uninsured children under the age of 19, between that 212% and 300% of poverty. So that would be the number of children that would be affected by this. The expanding the evidence-based programs that are reimbursable under Help Me Grow. We have a lot of community organizations that are doing great work with families, and they're having amazing results, but their programs, while they're evidence-based, are not reimbursable under the Help Me Grow program. So we'd like them to look at opening that up a little bit. Increasing the eligibility for publicly funded childcare to 200%. The Medicaid coverage of doula care services. This came so close to passing last year. We'd really like to see that get done in the budget. This is physical, emotional, and educational support for women while they're pregnant. We know that doula services prevent poor health outcomes for mothers and babies. And we also know that Ohio has a real problem with those health outcomes. I think we need to acknowledge the need to fully fund the Fair School Funding Plan. That really does ensure that all of these other investments are as effective as they can be and they build on each other. Hunger-free schools, more funding for free lunch program in schools to ensure that all Ohio students have access to free school meals without the stigma that is often associated with free and reduced price lunches. A fully refundable child tax credit, which I mentioned before. And then I will put a plug in here for the Ohio Children's Budget Coalition. We've recently said many of the people on this webinar are part of this organization. We've recently laid out priorities for creating a vision of child well-being in Ohio. And I think we're going to drop a link to those briefs in the chat. Please feel free to look at that, and you can see what the Ohio Children's Budget Coalition is pushing for in this coming budget as well, which I think lines up very closely, almost exactly with everything you're hearing on this webinar. So thank you for your time. And at the end, we're happy to answer any questions.
Fantastic, Kelly. Thank you so much. And thank you for the guest star of your cat coming in to say hello. What a cutie. Very quickly, Kelly, one question for you. We know that you talked about the new Department of Children and Youth. We know that there's a lot of programs moving into this new department. Can you speak to, I know we're still waiting on some new details, but can you speak to, how this will be implemented, and whether and how specifically how Families and Children's First Councils will be playing a role? I know in their new organizational chart, they were pretty high up in that, with the director.
I have not really seen, other than the slides that the new department put out right after the governor's state of the state. I really don't have a lot of details on that. We're looking forward to those and happy to push those out as soon as we hear more details on how this is going to be rolled out.
For sure, we know that those programs have really close ties and have been in different departments for a very long time. And yes, 18 months doesn't even feel long enough to untie all those strings, but we look forward to it. And thank you, Kelly, so much for your comments. And coming up next, I would like to invite Gina Wilt from Ohio to join us. Some great and hopeful news from the governor and a commitment to affordable housing here in the state. So Gina, please take it away when you're ready. Thanks for being here.
Thank you. Thanks, everyone. Ohio, just as a reminder, we are a statewide advocacy organization. Our mission is to end homelessness and promote affordable housing. And we really do believe that we can end homelessness with the right public policy and political will. And I do have the title of the slide here. It's a quote from Governor DeWine's State of the State, his pledge to the people of Ohio. And on the next slide, you'll see, I think, why he made this pledge. We're definitely partially because everyone across the whole spectrum is feeling the housing crisis. And the next slide will just we'll go through a little reminder. And many of you have seen this slide before. It really paints the picture of why people are struggling with housing stability. So as we dive into our budget solutions, we can just have this great reminder of where we're at. So rents are rapidly rising. We're all feeling that. Homes are definitely out of reach for far too many Ohioans. And a full-time worker has to earn $17.05 an hour to afford a very modest 2-bedroom home. So in the next slide, you'll see, of course, here that these rapidly rising rents and our eviction crisis. So the eviction case filings are not going down. Unfortunately, they're going up. And in certain areas of the state, evictions have gone up even higher than pre-pandemic levels. So on the next slide, I just put this link here, my non-tech, I wanted to screenshot a picture, but I thought this was a great study. It really shows us that Ohio, we're not alone in this affordable housing crisis. So if you're interested in digging deeper into the topic, I highly recommend this study that just came out from Harvard's Joint Center on Housing Studies. And it's just really about the record numbers of renters who are cost burdened. So that means they're spending more than 30% of their income on housing. So that in combination with surging prices all around, they go through all the different things, but it's great research. And the data indicates that the policies that are needed should be targeted toward low-income populations. So policies and programs that are targeted towards low-income populations, and strategies also that would help us increase our housing supply. So, and how if you do both of those things, it actually benefits the entire spectrum of needs. So everyone. So I thought that was a really good study if you want to screenshot that or check it out. But on the next slide, going into the governor's budget, really no surprises, no big surprises for us in the governor's budget. This slide is just kind of what was easy to pull out and were already itemized out. Other items that were included are a little bit more nuanced, or we're still waiting to learn more. But of course, the Ohio Housing Trust Fund, which is the top part there, I emphasize enough how important the Ohio Housing Trust Fund is, how important it is to continue the work there. That is the most significant resource for housing and homeless services in Ohio. And it has there's lots of things that it does. The three main things: aging in place, homeless services for the whole state, aging in place for the whole state, and then also development. So talking about affordable housing development. It looks like there's an increase. And of course, no GRF, no state money technically goes to the trust fund. The trust fund is funded by county recorder fees. So people go to the county recorder's office and file their documents. We split that money with the county recorders. So the Ohio Housing Trust Fund gets half and the county recorders get half. And so that's how the Ohio Housing Trust Fund is funded, not through GRF or anything else. It's through county recorder fees. And you'll see fiscal 23, 55, that's our spending authorization. So that's just the spending authorization. So thankfully they are increasing the spending authorization to the 65 million in fiscal in both 24 and 25, which is great because the money has been there. We just haven't had the authority to spend it. So it's not technically an increase. It's just they're actually switching the spending authority. And then we also, we're happy to see they're continuing the work with the homeless children's education, that line there. And that's really training our McKinney-Vento liaisons in the school districts all throughout Ohio and all around the state. And then, of course, the Ohio Department of Health, they're going to continue, very happy they're going to continue their work that can be dedicated toward youth homelessness. And on the next slide, and very excited, we were very thrilled to see the investment into Healthy Beginnings at Home, which we'll be able to work, we'll continue that work. It'll be a part, I guess, of this new Department of Children and Youth, and it will be $16 million for the first year, $1 million for the last year. As a reminder, Healthy Beginnings at Home, it is a public-private partnership, and we leverage all kinds of dollars with philanthropy and the locals. And on the next slide, I think some more. Yeah, so collaborative effort, reducing infant mortality, with the intervention of actual housing assistance and being able to be statistically significant with our science so that we can work throughout the whole state and then also work with Sherrod Brown and other federal advocates and the Health and Human Service team in the White House to make this a national effort. So really excited about the work that we've talked about it before. So I'll go to the next slide. The other item that the governor mentioned is the state low-income housing tax credit. So there is a federal low-income housing tax credit. This would be a state one, and it would, and we've been working with the health community for a long time now, and we talk about the social determinants of health, and it's been a very, not only are health professionals, I guess, starting to understand the importance and the intersection between housing and health, but the business community has definitely been very vocal and has done a ton of advocacy around housing and the development of affordable housing, as they've been hearing from their employers. They want to come to Ohio, but where will people live? So this, I think, is the fruits of the work of the business community really going out front on the housing issue. So on the next slide, I think is just more explanation. Yeah, about 20 other states have a state tax credit, and it works because it leverages other funding resources and it leverages the federal income, more money out of the federal housing income tax or tax credit. So Of course, it drives the creation of affordable housing and workforce housing, if you want to call it workforce housing, family senior housing, but it's public-private partnership, and we're really excited to work with the wide multi-sector organizations that support this. In the next slide. And then housing map for homeless families, we don't see it in the budget. Hopefully it will be part of the JFS TANF work that we see as they announce what those line items look like. We worked on this through the governor through executive order, but we would really like to continue this work. We had to stop the program because it was, we only got the money through the executive order. We would like to continue this work. We have agencies all throughout the state that have been very successful in using TANF dollars to work with their community's homeless population. And it's just a great way that they can bring all kinds of resources together. And the best thing about this program is how quick they're able to address issues, and it just gives them more flexibility. They can be a lot quicker. They can be very nimble, and prevent families from having to be on the street. So it's been a great program. We're hoping to see more on that. And the only other thing I will mention is that we did, unfortunately, after the governor made his budget announcement, there was comments by the Senate president that that weren't so positive. So we do believe that there are some hurdles that we will need to clear on the overall education and outreach on the need for affordable housing. But Senate President Matt Huffman, he told reporters about the governor's budget in relation to creating the state low-income housing tax credit, that he believes it will create, and this is, I'm quoting, a migration of folks from home ownership into largely publicly funded housing projects. So we have some myths to debunk. By creating affordable housing, we certainly aren't trying to take people out of home ownership. I don't really think that would happen. So we have our work cut out for us in explaining that, explaining really the economic situation and the wages that people are making, what they're able to afford. If your family's making $20,000 or $30,000 a year, homeownership is probably not the path for you. There are a lot of expenses that come with home ownership. So we need to develop affordable housing to keep people in their homes too. And so we have our work cut out for us, but we're excited that the governor included it in his budget, and I'm happy to answer any questions.
Gina, thank you so much for your time. Just wanted to point out you do have 2 great questions in the Q&A. If you want to take a look at that as we move forward to our next speaker, we are happy and excited to welcome Jordan Ballinger from Disability Rights Ohio to tell us about what he thinks is great in the budget, what they're looking for, and what they'll be pushing for in the next few months. So Jordan, thanks for being here. Take it away.
Thank you, Kelsey. Thank you, Sarah. Thank you, AOF. Thank you, everyone, for being here today. We at DRO are very excited about this budget. I'm sure many of you have heard myself, along with other people in the home and community-based service space, talk about the direct care workforce over and over and over and over and over again for several years now. This is one of the first budgets where we are seeing a real investment from the state of Ohio into our direct care workforce. So we were very excited. So I'll detail more. I'm going to specifically be looking or kind of going over the Department of Developmental Disabilities, and then Beth is going to talk more about the Department of Medicaid and how those dollars will help with this increase in the direct care workforce. So next slide, please. So as you can see here, there is a huge increase in the investment from the Department of Developmental Disabilities, and that is largely due to the increase in the funding for our direct care workforce. Next slide, please. So specifically, we're looking at $579 million just for the Department of Developmental Disabilities, specifically, with the primary purpose of increasing direct care wages. On average, wages right now are around $12 to $13, depending on which service system you are in. The Department of Developmental Disabilities put out a release a couple of days ago, maybe it was yesterday, time's not real during the budget, that is indicating an increase to support wages for $16 an hour, which is a tremendous investment and will help ensure that our direct care workforce is competitive with other workforces. What we have seen since the beginning of the pandemic is an exit of the workforce into other industries due to higher pay. It's very hard to compete when there are other industries paying starting out $16, $17 an hour. So this will at least bring us up to a wage that is competitive with other workforces and hopefully can help us attract more individuals into that workforce, providing essential care to disabled Ohioans. Specifically, the 16.5% increase is going to things like homemaker personal care, shared living remote support, and those with complex needs. There is also a 10% increase for other HCBS services. So that would be like adult day support, vocational habilitation, group employment, non-medical transportation, and self-directed transportation. We're also super excited. DRO, one of our priorities over the past couple of years has been supporting disabled advocates to take a seat at the table and really have their voices heard. So this proposal by the department that would require boards of developmental disabilities to have at least one person who is eligible for services be appointed to those boards is an incredible step forward to ensure that those who are using the service systems are also those who are saying what needs to be addressed within those systems. Another big thing that's been talked about the past few years in our areas is adult changing tables within public places and businesses. The department has indicated that they will partner with organizations to increase the availability of these adult changing tables. So we are super excited to see that. And then, of course, one of the big things as well from the department is an increased funding in support for multi-system youth. The one other thing I want to mention, which I don't have in these slides, is the Vocational Rehabilitation Agency Opportunities for Ohioans with Disabilities will be drawing down for the first time its full federal match, which we are also, I keep saying excited because a lot of this budget is to be excited about, but we are excited so that the state can finally take full advantage of that federal funding to provide employment services to disabled Ohioans to help them attain and retain employment. And although all of this is a really, really great foundation, one thing we are looking forward to learning more about as we get more details from the budget in the introduced language and the red book is long-term sustainability of these wages. We really want to ensure that our direct care workforce is sustained over the long term and that these wages continue to grow as inflation grows as well. And we are really interested to see what it is this administration is proposing to ensure that long-term sustainability. You can go to the next slide. This is just my contact information. Feel free to reach out if you have any additional questions that come up after this, and I will turn it over. Thanks, Kelsey.
Jordan, thank you. Man, great news. Good things to celebrate here. And hopefully that continues with Beth Kowalczyk from the Ohio Association of Area Agencies on Aging. Beth, thank you so much for being here and for rounding us out this morning, almost afternoon, but please take all the time you need. We're excited to hear what's in the budget for, again, older adults and making sure that those services are strong moving in to this budget cycle. So Beth, please take it away when you're ready.
Thank you, Kelsey, and thank you, Advocates for Ohio's Future, for having us here today. I'm Beth Kowalczyk, the Chief Policy Officer with the Ohio Association of Area Agencies on Aging. The association, which we call O4A, ensures that Ohio's 12 area agencies on aging and the older Ohioans that they serve have a voice at the Ohio State House with members of Congress and with state and federal agencies through the legislative and regulatory process. Ohio's area agencies on aging administer and provide care management and supportive services through federal, state, and local programs that provide home and community-based services to older adults and people with disabilities. The area agencies on aging enable all of us to continue to be active members of our communities as we age, which makes our community stronger. I would like to give a shout out for our advocacy conference, which is happening on March 21st and 22nd. You can go to ohioaging.org for more information on that, and you're welcome to register and attend. I do want to point out that many of the things that were talked about today, including housing, nutrition assistance, and behavioral health, also support older Ohioans. They're part of the population that benefits from those services, as well as people with disabilities. And so we're encouraged by what we're hearing with the discussion so far, and we will be advocating in those areas, as well as what things I'm going to be talking about next. So you can go to the next slide. So looking at the Department of Aging Blue Book, there are a couple things that are mentioned that are actually really supportive, and I think are going to go towards a long way towards helping older adults. The first is healthy aging grants. This is a new line item. It's $40 million in state ARPA dollars. It'll be one-time dollars for pilot projects that will be grants to local partners, and it's intended to support quality of life for older adults in their homes and communities. And so it will be a broad range of potential services that can be funded. PACE, the Program for All-Inclusive Care for the Elderly, is a specific program that we have one center right now in Cuyahoga County, the McGregor PACE program in Cleveland. Both House Bill 45, which was the Christmas tree bill, and lame duck, and has been carried over into the discussion with the budget, is the idea of expanding PACE to 6 more counties, mostly urban counties around the state, with $50 million to expand that program. PACE provides comprehensive medical and social services to older adults who are living in the community. It's tied usually to a location like an adult day center. And most of the individuals in PACE are dually eligible for both Medicare and Medicaid. Another thing that we're actually really excited about, because we continue to advocate for increases in state funding to support programs for older adults through our senior community services program. This is a line item that provides state funding to draw down federal Older Americans Act dollars. And it has been cut significantly in the last several years, and we've been advocating to build this back up. And we're excited to see an additional $3 million per year being proposed in the governor's budget to support that program. And this is to serve people who are not on Medicaid. It supports things like Meals on Wheels, transportation, home modifications, personal care. And it also has been a way for the state to expand the Senior Farmers Market Nutrition Program. There is an additional $2 million per year in state funds for Alzheimer's and dementia respite programs in the state. This is purely state dollars. The intent is to increase resources and caregiver supports and to provide for a statewide dementia coordinator. Other things mentioned in Department of Aging Blue Book discussion includes an aging economy report. You know, we are lucky that we're all living longer and there are more of us. And so what impact does that have on our economy? What is the impact of a longevity economy? And so the proposal is to do a biennial report to share information to impact policies, programs, and funding to support Ohio to be the best place to age, is what has been indicated in the budget Blue Book, and I think we would all agree with that. And also investments in technology. We have a system that is pretty old, and we need to look at how we can invest to take advantage of new technologies across the spectrum, from operational to services for older adults. And before I get to Medicaid, I also wanted to point out in the Job and Family Services budget, there is an increase of $4 million per year for adult protective services. There is no other funding that is dedicated nationally for adult protective services. So it's really up to state funds and if a county has local funds to supplement that. And so having $4 million per year in additional funding for that is tremendous. Now, moving to Medicaid, as Jordan mentioned, in the DODD budget, it was very explicit that there would be funding proposed for increased wages for the direct care workforce to support people with developmental disabilities in the community. And that would raise the wages to $16 per hour. We are asking for similar increases up to $20 per hour in aging and programs that serve people with disabilities who are not in the DD system. And we are asking that that be a level playing field with the workers in the DD system and frankly, folks who go to work in nursing homes, because in the aging space, the average wage is between $10 to $12 an hour for these individuals who provide personal care on a daily basis to individuals living in their homes. They do not receive mileage. They do not get paid training. And the providers that provide these services don't necessarily get enough funding to be able to provide these on a consistent basis. So we now have over 2,000 people in our Passport Aging Waiver Program who are in the program enrolled and are waiting for services. That's 2,000 people across the state. And when you look at all of our programs, we have over 4,000 people who are waiting for personal care services because of this direct care workforce shortage. And so what we've heard, and this is the only language in the Medicaid budget that talks about workforce, it is not explicit. It doesn't say that how much increase in wages would be or what provider rates would be increased. But in things that we've had some conversations with folks in the administration that are understanding that their intent is to make a level playing field. So we are hoping to hear that there'll at least be a $16 per hour wage proposed for aging and for Ohio Home Care Medicaid waiver as well. But you can rest assured that's what we'll be advocating for. So we can go to the next slide. And then I do have to point out that when the governor gave us State of the State, we were a little disappointed that the only focus on older adults, considering a lot of these things that we're talking about, the only focus that he had in his State of the State was in nursing homes. But do appreciate the forceful statement about quality being considered when talking about increasing rates or rebasing for nursing homes, because that's incredibly important. And what the governor also said was that he'd be appointing a task force that we understand is going to be moving quickly to go across the state, gather information to help inform policy and I would assume rates in that discussion with the budget, because this is always a big topic of discussion in the budget. So we have to be aware of that going on as we advocate for the home and community-based services. And that is all I had.
Beth, thank you so much. And truly thank you so much to all of our panelists and NAOF members who are here with us today for giving up part of your Friday to be with us and answer questions. And truly, I mean, we still have over 128 participants on with us through the 90 minutes. How incredible. We know folks were eager for an overview of where the initial process is starting, our initial analysis. And as we continue to get more information, we will, of course, continue to have this budget webinar series planning for every other week here through June, truly, schedules permitting. If there's a lull or maybe spring break or such, we'll take a break as well. But we want to make sure we provide you with the most up-to-date information as possible and diving a little bit deeper into specific subject areas as the budget continues, as things get interesting. We know this is just a first look. We know both the House and the Senate will have a couple different opportunities to make changes, to make insertions, to remove items from the governor's budget as they see fit. will certainly be an interesting process. So we do have 2 questions that are unanswered here in our Q&A, and also wanted to just direct your attention to that answered slide on the Q&A section. We know that a lot of our panelists have entered in or typed in their answers to a number of questions if you asked one. So take a look there to see if your question is there and answered. But wanted to quickly call Darold Johnson back if he's still here. He may have hopped off. I know he had a meeting coming up at noon as well. And if we do not answer your question, we are happy to send you or send a response from all of us. So Darold did have to hop off. He's our resident education expert. But there is one question I'm actually curious to ask to the crew here. Is there any funding in the governor's budget about improving communication in terms of communication and language availabilities, interpretation, translation for government services, government notices? We know that we've seen an effort by Jobs and Family Services to make sure that their notices that go out, that there's translations available, but I am not aware of any additional funding or resources or support included in the governor's budget for kind of those purposes. And if any of my panelists have heard differently, it would be interesting to hear. But we don't know of much, but that is a fantastic question. And that's something that there should be more of. We would agree. And without seeing any other questions, folks, I want to thank you for your time, for being with us today. Look at that, ending 3 minutes early. Should be a record here with AOF. Again, we're thankful to have you. We'll be coming back in 2 weeks with an update. Again, we will hear lots more from agency directors, in-house finance these next few weeks, from questions from members and such. So we will keep an eye on what we hear and certainly be here to share it with you. So once again, the recording of our conversation this morning, as well as all the slides, will be sent out to everyone who has registered for this event. And will also be available on our website at advocatesforohio.org/webinars. So those will be up and available at any time after we finish. So friends, thank you again. We are grateful for your support and your advocacy. Join us here in 2 weeks for our next edition, next installment, and make sure you sign up for our newsletters on our website so you get that first registration information. You know when those big items are coming up, and make sure you follow us on social media at advocates, the number 4 OH on Twitter and Facebook. Thanks so much, everyone. Please enjoy the rest of your day. Stay warm. We'll see you again soon.